Hello, everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own doctor, Dr. Krishnamani, to spread awareness about the cancer and to help caregivers and patients to access the right treatment at the right time. November is Pancreatic Cancer Awareness Month, a time to shine light on one of the toughest cancers to detect and to treat, yet one where awareness truly can make a difference. Pancreatic cancer often develops quietly with symptoms that are vague or easily mistaken for other conditions. By the time it's found, it's sometimes already advanced. That's why early detection, understanding the risk factors, and recognizing warning signs are so important. In today's session, the Pancreatic Cancer Playbook, Detection, Treatment, and Life Beyond Diagnosis, we will walk from how pancreatic cancer develops, how it is detected, what are the evolving landscapes of the treatment, and discuss about life after the diagnosis. Joining us for today's session is Dr. Krishnamani, one of the most respected voices in oncology. He has been with AY hospitals here in Hyderabad since more than a decade, where he is known for his expertise in managing solid tumors, hematological malignancies, and oncologic emergencies. His journey spans international fellowships and leadership roles at some of India's top cancer centers, giving him a truly global perspective on cancer care. He's also contributed immensely to the field, from shaping cancer treatment protocols to influencing cancer care policies and driving research that truly makes a difference. Hello and welcome to you, sir.
Hello, welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness on cancer. And as you pointed out today, let's talk about pancreatic cancer uh, because this is the Pancreatic Cancer Awareness Month. And let's discuss some points about how do we diagnose, how we treat, what are the symptoms which are bothering a patient, etc.
So, sir, can we start by understanding what the functions of the pancreas are in the body? Very basic level.
See, pancreas is an organ below the stomach, if you look at the diagram. It has both endocrine and exocrine functions. Exocrine means it secretes certain liquids or enzymes which are involved in the digestion of your food, like how the gallbladder secretes bile. Pancreas secretes certain pancreatic enzymes. Endocrine function means it secretes insulin to keep your sugar under check. So diabetes mellitus or diabetes, which we commonly call, is because of a insulin deficiency in your body or insulin resistance in your body, which leads to high sugars. And why does the insulin deficiency come? Because your pancreas is damaged. So diabetes mellitus or diabetes as we commonly call is basically a problem in the pancreas and a problem with insulin secretion or insulin function. The exocrine part, as I told you, is enzymes which helps in digestion. So pancreas has both these functions.
Sir, can you explain how cancer develops in the pancreas or what could be the causative factors for cancer development in pancreas?
So before that, I would want to give a brief intro kind of on how bad this disease is. So you're dealing with a very, very bad disease. Understand that. So pancreatic cancer is one of the fundamentally bad diseases which we come across. The reason I say that is, if you look at the 5-year survival, pancreatic cancer 5-year survival for disease which is even localized, that is still in the pancreas and not gone beyond the pancreas, is close to 40%. And for spread, if for the cancer which generally spreads, the pancreatic cancer which is spread beyond the pancreas to the liver, lung, etc., the 5-year survival is practically zero. That is, most patients would die of pancreatic cancer if they have advanced pancreatic cancer. And unfortunately, pancreatic cancer presents generally in an advanced stage. To pick up a pancreatic cancer in an early stage is very difficult and very rare. Now, having said that, what are the causes? The causes are smoking. Cigarette smoking is one of the most important causes of pancreatic cancer. Obesity is an important cause of pancreatic cancer. Pancreatitis, repeated attacks of inflammation on the pancreas due to alcohol intake or stones or something called Tropical pancreatitis, we say, which will lead to chronic pancreatitis, can lead to pancreatic cancer. What happens is, over a period of time, the pancreas is getting burnt or inflamed, and that turns into cancer. So, smoking, obesity, pancreatitis are the common causes. Then there is something called a genetic variant. That is, 15 to 20% of pancreatic cancers can happen in families where they carry certain mutations like the BRCA1-2 mutation, which is seen in the breast and ovarian cancer. These patients have a 5 to 15% risk of pancreatic cancer. Then there are certain other genetic mutations like Peutz-Jeghers syndrome or the SKN2, PALB2 mutations, etc., etc. So bottom line is the causes of pancreatic cancer, smoking, so stop smoking. Obesity, so maintain a very healthy lifestyle. Balanced diet, green vegetables, fruits, fruit juices, good proteins. We keep mentioning that. Genetic factors. So somebody in your family is affected with pancreatic cancer, or more than two members are affected. Start searching for any of these mutations like BRCA1 or 2, which can probably guide you to take steps for the next generation.
Sir, when you talk about the disease, is it more rampant among elderly or among children? And which gender is
Elderly.
more?
Elderly. Pancreatic cancer is a disease of the elderly. You generally see patients above the age of 60, 65.
And so between the genders,
Men more
were more
commonly than women.
common. So can you tell us about the signs and symptoms of the disease?
Generally, by the time a patient develops symptoms, it is usually advanced. Some of the common symptoms are severe pain, abdominal pain, or abdominal pain, which also can radiate to the back, which goes to the back. Extreme weight loss. Somebody who's lost a lot of weight recently start thinking of stomach and pancreatic cancer. Recent onset high sugars. Somebody has been normal and suddenly the last few months you say the sugars are 400, 500, HbA1c is very high, then suspect pancreatic cancer. So a recent hyperglycemia may herald the onset of pancreatic cancer. That is, recent high sugars may be the first indication that you have pancreatic cancer. Extreme weight loss, recent hypoglycemia, and then abdominal pain, boring abdominal pain. Boring means it is a nagging pain, constant pain, which is a severe pain, sometimes requiring high-end painkillers in the form of narcotics. Finally, pancreatic cancer can also lead to jaundice because it can block the bile ducts. Because the pancreas is around the bile duct like this, when it blocks the bile duct, the bile will not flow down. The patient develops jaundice. When the jaundice is high, they can develop itching. They can have vomitings and other non-specific symptoms. So jaundice, weight loss, loss of appetite, severe boring abdominal pain, and recent onset hyperglycemia.
So can you walk us through the diagnosis for this disease?
So when you talk about diagnosis, it is like how we classically define. So how are you going to? So the first thing is when you have any of these symptoms, you're going to image. You will first do a small ultrasound of the abdomen. Ultrasound sometimes may not pick up because the pancreas is a posterior organ. So then you will have to do a CT scan or an endoscopic ultrasound, a CT of the abdomen with contrast. So I will do test to image, which is your CT scan, which will say whether there is a tumor-like thing sitting in your head or body or tail of the pancreas, we say, whether there are any nearby lymph nodes, whether it has spread to the liver or not. Then you will do test to confirm your diagnosis, which is a biopsy, either from the pancreatic lesion or from the liver lesion, etc. You will do test to stage the disease. You will do a CT scan of the chest, neck, or you'll do a PET CT to look where all it has spread. Then you will do certain blood test called CA 19.9. That's a blood test done and it is elevated in pancreatic cancers. It can be elevated in normal conditions also. It can be elevated, I mean, in non-cancerous conditions like cholangitis, like infections, like gallstones, stomach cancer also it can be elevated. So it can be elevated apart from pancreatic cancer in other cancers or other non-cancerous conditions. So first of all, you'll do a CT scan or an endoscopic ultrasound. If you have a pancreatic mass, you will do a biopsy. Then you will do staging in the form of chest CT or a PET CT. You will do tumor marker CEA, CA 19.9. If they are normal, doesn't mean you don't have pancreatic cancer. The biopsy is the final proof. On the biopsy, you will do something called immunohistochemistry, which will take 3 to 4 days to come to give you the report. And finally, you will do tests to assess the general health of a patient, which includes the complete blood picture, kidney function, and more importantly, liver function to look if there is jaundice or bilirubin. So this is the way you're going to diagnose a CA pancreas.
Sir, are there any screening tests for this disease
So
which can be routinely done?
the screening is not routinely advised. Screening is advised maybe in the familial pancreatic cancer in those patients who have two or more relatives who have suffered with pancreatic cancer. You will do endoscopic ultrasound or ultrasound abdomen. If there is something suspicious, then you will do CT, etc.
Sir,
But general
once the
population, there is no screening.
okay. So once the diagnosis is confirmed, then what are the treatment options which are available for the patient?
So your diagnosis is confirmed with, I told you, with a biopsy and an IHC. After that, you have to sit with the surgeon and the radiologist. Is it a disease which has spread? If it has spread, it is stage 4. Treatment is palliation. It is not curable. You're going to give chemotherapy. Simple, straightforward. If it has not spread, talk to your surgeon. Is it localized? Can it be resected? Can it be removed? If a surgery can be done, go ahead with surgery. There is something called borderline resectable. The surgeon sometimes will say, now I cannot operate. You give something to shrink it and then I can operate because it is very close to major blood vessels. Then you give chemotherapy or radiotherapy, you shrink the tumor so that the surgeon can operate later. That is called borderline resectable. Sometimes the surgeon may say it is unresectable. Whatever you do, I cannot operate. Then you have to treat it like a stage 4. So surgery is a part of the treatment, radiation is a part of the treatment, chemotherapy is a part of the treatment. Stage 4, spread, chemo is the treatment of choice. Not spread, localized, resectable, operate. Borderline resectable, give chemo or radio and then operate. Unresectable, cannot operate, so go ahead with palliative treatment.
Sir, are there any targeted therapy options for this disease?
Yes. So if you are metastatic pancreatic cancer and MSI high and TMB high, you will be given immunotherapy. If you are BRCA positive, you can be put on adjuvant, you can be put on olaparib in the metastatic setting. So yes, there are targeted therapies available. That's why pancreatic cancer patients should be submitting their blocks for NGS testing and their blood for germline testing for BRCA1, 2, PALP2, STN, etc.
So when you talk about the metastatic pancreatic disease, which are the organs where it spreads to most?
Liver, omentum, lungs, bones.
So, sir, we have spoken about targeted therapy and immunotherapy. Are there any advanced treatments also available for these patients besides these two? Or any advances in immunotherapy which can be given to these patients?
If you're MSI high or TMB high, you get immunotherapy. If you're HER2 positive, you're going to get trastuzumab-based therapies. If you're BRCA1 and 2 positives, you're going to get the olaparib, PARP inhibitors. So you're looking at NGS to look for actionable mutations so that you can target that.
So, can you explain about the prognosis of the disease?
As I told you, unfortunately has an extremely poor prognosis. Localized disease also, the 5-year survival is 40%. Advanced disease, the 5-year survival is less than 2%, probably even 0.
Sir, how do you counsel these patients and their family members because the disease is having such a bad prognosis?
So you have to be very fair with them. You have to be candid with them. You cannot, obviously, you have to be very clear about what you are discussing. You're talking about a bad disease. You have to ensure that they know it, the family knows it, what is the expected survival. And during that period of time, what are the problems they're going to have? Severe abdominal pain, severe pains, which may require narcotics or morphine, severe nutritional issues which may require IV fluids or parenteral nutrition or rice tube feeding. Then they're going to have ascites which may require frequent tapping. The abdomen may become loaded with fluid, so you may put in a needle and tap it. They may develop jaundice, which may require stenting in the bile duct to relieve the jaundice. Fevers, infections, which may require antibiotics, uh, regular counseling, and supportive care.
Sir, how do you counsel these patients for their mental health, especially because the disease is so bad, plus they're not going to have a light at the end of the tunnel, as you call it?
See, in stage 4, what you have to emphasize is quality of life. It is not longevity alone. So, what I'm going to tell them is, see, you don't look at 9-month, 12-month period, what the textbook says. That is not in our hands. But whatever time you have, we should have a good quality of life. We should be able to control the disease. We should not suffer with pain. We should be free of the symptoms. And then, if God is kind, if the medicines work, if the disease comes down, go forward. Also, the chemo treatments are quite toxic, so manage the chemotoxicities. Healthy food, being amongst family and friends, some things which you like, keep doing that. Finally, from a disease point of view, also send the tumor for mutational testing and do an NGS and do a germline testing. I'll give you a small example. So we have a gentleman, 2021, I had seen him. Stage 4 pancreatic cancer spread to the liver. It was 70, 72-year-old gentleman. He told him, you have stage 4 pancreatic cancer, biopsy proven, even in the liver. So the family is an educated family, was asking about the survival, 9 months to 12 months. Started him on palliative chemo, 6 rounds, 8, 10 rounds of chemo, completely almost bedridden because of the side effects of chemo, couldn't tolerate, though the scan was showing good response. He literally begged, saying that, please stop my treatment. I cannot take anymore. I'm 72, etc. Then we convinced the family, why don't you get an NGS? This is 4 years back when NGS was still just new, especially in practice. We sent an NGS. To our surprise, he was BRCA positive. So there was some data to put him on adjuvant, not adjuvant, to put him on olaparib, maintenance olaparib, we may say. So BRCA is a mutation seen in breast and ovarian cancer. He had that mutation. So the drug given for that is given here. You will not believe. It is 4 years down the line today. He gets PET scans every 6 months. He's in complete remission. That man walks 8,000 to 10,000 steps every day in his apartment. He's perfectly fine, doing extremely well. No complications, no disease recurrence. Did we ever even think? Recently, he even went to see his children abroad. And because he is BRCA positive, we have been able to test his son and daughter who are both BRCA positive now. So they are going to take precautions for prostate, pancreas, and breast and ovarian cancer, respectively, in the boy and the girl. So why I'm trying to tell you is this is one of the many stories. Most people in pancreatic cancer may not have this desired outcome, but we have to try. How was it possible? It was because of the NGS testing.
So, what message can you give our viewers on this occasion of Pancreatic Awareness Month?
So friends, let's understand it's a bad cancer. It presents in an advanced stage. Survival is low, but let us try. Let us try our best. Do not smoke. Have a healthy lifestyle. Do not be obese. Have a healthy BMI. If you have tremendous weight loss, boring abdominal pain for a long period, jaundice for some reason which is not getting better, seek a specialist consultation to see if you have a pancreatic problem or a recent onset sugar, diabetes. Rule out pancreatic cancer. If you are lucky, if it is found at an early stage, surgery alone, surgery should be really, really useful for you and help you for cure. And if you have advanced pancreatic cancer, get an NGS done. We, who knows, we may find some mutations which may have targets.
Sir, can you tell us about the Second Opinion campaign?
So as you all know, on Cancer Reach, we're running a second opinion campaign on our WhatsApp, so patients can get in touch and they get a free opinion. Uh, the aim is just to guide them and so that they can continue treatment wherever they are.
Thank you for enlightening us on pancreatic cancer, sir. We hope to see you again next Friday with another interesting session. Thank you,
Thanks
sir.
so much. Thank you. Bye.